Hi, everybody. I'm Leslyn Keith. I'm the president of the board and director of research for the Lipedema project. And I'm so happy to be here today with you again to talk about the latest research updates. I'm just going to make sure that I got my comments on so I can see if any of you do post anything as we're talking about this. I have another nice piece, a nice paper that I wanted to go over with you again today. But be sure that you put questions or comments. I love to see where you guys are from. And if you're interested in this paper that I'm reviewing, or if you have other papers you would like me to review, go ahead and put them in the comments. Feel free to email me, leslyn@lipedemaproject.org. Love to hear from you. So, and also I wanted to let you know a couple of the places that you can get information about current research with lipedema. We have our daily podcasts, the flash briefings. Be sure and check those out. And I periodically talk about recent research in our flash briefings and also our blog posts. And so a new post comes out every Thursday, and a couple of times a month, it's going to be a research update blog post. So both of those, you can go to lipedema-simplified.org and you can get the link into the flash briefings and also to the blog posts. So today, what I'm going to talk about, thank you for posting things. I see things coming in from Atlanta, Colorado Springs, Philadelphia, UK. Wonderful. Nice to have you all here. Today's paper that I'm going to talk to you about is Lipedema can be treated non-surgically, a report of 5 cases. And this is a great paper that was put out by Dr. Alexandre Amato from Brazil. Interestingly, he is a surgeon. He does liposuction surgeries on women with lipedema, but he also has a clinic and he helps manage the treatment of women with lipedema non-surgically. So it's pretty fabulous that he has published this paper. It came out just in November of 2021, and it's in the American Journal of Case Reports. So we'll have a link to it. Check out this paper. He's much beloved in Brazil. And he did speak at one of our symposiums also in the past about his treatments that he does for lipedema. So this paper is really interesting. I think you would enjoy it. It's 5 case studies, and he did get a person that was representing each of the 4 stages of lipedema. And so then he proceeded to describe what he did with each person. And he talks about how they presented on their initial evaluation, which non-surgical treatments they pursued, and what was the outcomes of that treatment. And so before doing any kind of treatment, he likes to do a very thorough evaluation, and he likes to use very objective, as much as he can, objective assessments. And so here's some of the assessments he used. He has an instrument called the Lipedema Symptom Assessment Questionnaire, and it has been validated and tested and actually modified to be culturally specific. And so he has one that he uses specifically with his Brazilian patients. And this is a questionnaire that the patients fill out, and it goes from 0 to 150. And actually a higher score means they are impacted more by the lipedema, they have worse symptoms. And so the lower score means actually they're doing better. And then he, of course, takes a volume measurement of the affected legs, and he does actually bioimpedance. And this can tell the body composition. It can tell how much fluid, how much fat, and usually it does a muscle also with the bioimpedance, but he was mostly concerned with what is the fluid and the fat content of the different body parts. And then he does regret, he said, there is no tool to measure the aesthetic aspects of lipedema, which that is a concern for his patients. And so he wished there was a way to assess the baseline of that and then have something to compare to at the conclusion of treatment on how it's gone. So, so he does those assessments. And then he said it's really important that you need to collaborate with the patient to figure out what is most important to them. What do they want to work on? What do they want to have the outcome of their treatment to be? And so he listed some things that are the most commonly stated by his patients that they are important to them. And so number one is symptom improvement. So whatever they list, their pain, their bruising, the size of their limbs, whatever symptoms they say, they would like those to improve. They would like to lose weight, and specifically to lose fat for a lot of them. And they want their size of their limbs to reduce. So they want that to improve. They want to improve mobility for those that have been affected and have, they're not moving as well. They have difficulty walking or getting up out of a chair. That is very important to them. And there is, like he said, there is several people that want to have that improved cosmetic appearance. And then it's very important for a lot of his patients to have a prevention of the progression of the disease. Hopefully, I mean, a lot of them say, hey, if I can't get it better, okay, but at least don't let this get worse. And so then he goes on to say, for himself, he feels like the most important thing is to preserve or recover immobility. So he kind of puts that at his top tier thing that he really wants to work on for those that have been affected this way. He wants to make sure that either it improves or at least it doesn't get any worse with mobility. And then secondarily, he wants to focus on the other symptoms, such as making the limb get smaller, aesthetic improvements, and also, he says, decreasing the psychological impacts. So you can see he's really looking at the overall person, and it is very important for him to collaborate with his patient to make sure that he's doing what the patient wants. So in these 5 cases that he presents, I think there was 2 of them that were in stage 2. We had 1 in stage 1, 1 in stage 3, and 1 in stage 4. He generally had some commonalities of the interventions that they agreed to and wanted to participate in. And number 1 was an anti-inflammatory, low carbohydrate, and in some cases, ketogenic diet. They all had manual lymph drainage. They all, I would say not all of them, but most of them had antioxidant supplementation. So they took specific supplements that he directed to help reduce inflammation in their body. They all did some type of exercise, usually aquatic exercise. And interestingly, he said that he did not include compression therapy if they were in a heightened inflammatory state. And so actually none of these patients that he presented on their case studies, they all had high inflammation and the pain was not good. And so he did not want to introduce compression therapy until their pain was reduced. So that was really interesting. And so, and then he made the comment that despite whatever stage they were in lipedema, these treatments were very successful in reducing the symptoms and significantly improving the quality of life. So it is interesting that anybody from stage 1 to stage 4 can have a nice outcome and can have improvements non-surgically. And this is coming from a surgeon, as I said. So the outcomes that each of these patients had, they had improved cosmetic appearance. And what he really showed with photos, that the skin was smoother. And so they have that like cellulite mattress-like appearance of the tissue, particularly on the thighs. And at the conclusion of treatment, then the skin was smoother or even completely smooth. Interestingly, one patient who had nodules, who's talking specifically that this was a symptom that bothered her, was those balls of fat, hard nodules in her legs. They were reduced. That was a fabulous outcome, not surgically. All had reduced limb volume, all had improved quality of life. There was decreased inflammation and decreased pain. And they had improvement or resolution, complete resolution of secondary conditions that had to do with venous problems. One patient, I think it was a person who was stage 4, had an infection, and so improved wound healing, all this kind of stuff. Those secondary things were improved, or sometimes, like in the case of the infection, completely resolved. Interestingly, the stage 3 case study, he said that she was a candidate for surgery, and that was an intervention that was offered to her, and she declined. She said, I wanted to try the non-surgical options first, and she was highly successful, so did not go on to have surgery. So that was pretty neat. Now, he said, he made some comments in here that I actually quoted them, and I wanted to share those with you because I think they were so important, things that he said. One is, this is coming from a surgeon, surgical treatment should not be performed in the inflammatory phase of the disease, similar to what he just said with compression therapy. It hurts too much. He felt that the best time for decision-making about surgery is when the patient has reached the best symptomatic state. So he wants to, even if they think that they might want to have surgery in the future, he wants to reduce that inflammation and reduce their symptoms. And now let's put surgery on the table if that's something that is still indicated and something that you want to do. And he also says, currently there are many described therapies available for lipedema. Liposuction surgery for lipedema should be considered a possible tool to be used and not the only available treatment. And you will see this in a lot of papers done by surgeons who are talking about the fabulous outcomes of their surgical procedures. And it is stated in several places that this surgery is the only known treatment that can stop the progression and reduce the symptoms of lipedema. And we know that that's not true. And this is exemplified in this paper by Dr. Amato, that these non-surgical treatments can stop the progression and reduce symptoms. He just said that complications of lipedema like ulcers, lymphangitis, and erysipelas, that's the infection, can be a main patient concern and can be treated without liposuction. And I think also preferentially treated without liposuction. In patients with lipedema with comorbid disease such as varicose veins of the lower limbs or obesity, failure in the clinical treatment of lipedema may cause failure in the treatment of the associated disease. In other words, that if you are not treating the lipedema correctly, then the obesity and the venous disease or whatever those other comorbidities are not going to get better either. So he thinks you really need to be able to treat the lipedema appropriately. And he really emphasizes that the treatment objectives should be individualized for each patient. This is another quote, it is imperative to understand each patient's needs to offer the best therapy attainable that meets patients' requirements and induces a better quality of life. I don't know if there's anybody here listening right now from Brazil, but I know he's much beloved in Brazil and love to hear from you in the comments if you're here. This is, I think he's very, very concerned with his patients' quality of life. And he also says some patients may demand better aesthetics, not an unreasonable desire, which in some cases is reachable without surgery. And this is, most surgeons who do liposuction surgery feel like the only way to get aesthetic improvement is through surgery. And he's saying, no, most patients report pain, discomfort, symptoms that can be improved without surgery. Our patients may be concerned about leg volume and disproportion reduction may seem challenging without surgery, but we have shown it's possible. And he has pictures of these case studies in the paper. You can see how they improved. And with the stage 1 lipedema, you don't see it as much because she's not as advanced. But you can see, like, for instance, just the skin improvement, smoother. So you do see it. And then lastly, one last quote from him is that lipedema requires an integrated, multi-specialty and multidisciplinary teamwork, patient-centered approach. Wow, sounds just like what we are advocating with Lipedema Simplified and the Lipedema Project. Non-surgical treatment of lipedema is feasible in selected cases, and it can meet the criteria for achieving selected clinical outcomes. So it can be treated non-surgically, although surgery may be an intervention that is needed by women with lipedema. It should just be as part of that buffet of options. And it's important to know that there is a buffet of options. It's not just surgery that's available. We have lots of other non-surgical options. And so with having said that and reviewed this fabulous paper, I want to let you know about a free webinar that we have coming up where we're going to be talking about just that, about those non-surgical physical options. It's comprehensive and creative physical management strategies for lipedema. And we're going to be having this webinar on Monday, August 1st at 6 p.m. It is free. Be sure you register. Even if you can't make it on that date and time, you have to be registered in order to get the replay. And then you can watch it whenever you want. Or if you are there, you can watch it again to make sure you didn't miss any information. So be sure you register. We'll have a link for that associated with this Facebook Live. So I'm going to be presenting at that webinar with two of my colleagues, also certified lymphedema therapists. And that's Veronica Rodriguez and Adi McKenzie. So all three of us are therapists who treat lipedema, of course, non-surgically. And so we're going to talk about all that variety of options that are available to you. This webinar will be an overview of that, but we also have some other techniques that you can use right away at home. And one of those is going to be some deep breathing exercises that is fabulous to do for all kinds of things besides reducing anxiety, but it helps lymphatic function. And so we are going to be working on things like that, breathing exercises. We're going to be talking about your wellness vision and making an overall plan on where you want to go, where you want to be for your health, and making what's called SMART goals to help you on that journey. I'll be talking in this webinar also about an overview of a coaching special interest group that we're going to be offering in August that is going to be in detail going over all of these physical management strategies. And so that coaching special interest group, or a CSIG, it has the same name as this webinar, Comprehensive and Creative Physical Management Strategies for Lipedema. And so we'll be talking about manual therapies, compression therapy, vibration, complementary treatments that you might have heard of, like dry brushing and things like that. And we'll also be talking about skincare. So hope that you can join us for this free webinar. Like I say, the link is here for you to register. Be sure you register, because even if you can't make it that day and time, you will be able to get that replay and get the information. And thank you so much for being here with me today. I would love to get your input. If you have other papers you would like me to review, or you have some questions. Gail says, hi, wonderful to have you here, Gail. And Jennifer says, I tried keto for a year and only lost 20 pounds and it didn't help my legs at all. And so Jennifer, definitely stay involved, because sometimes it just needs some tweaking to meet your specific needs. A general ketogenic diet is not a one size fits all. You have to make sure that you're addressing your particular issues. Sometimes coaching can help with that, or at least being involved with our Facebook group and asking questions. And Angela says, I'm stage 3-4 and did strict keto for over a year and didn't have any changes in the lipedema areas of the legs and arms. And so, again, Angela, I think another person that would be great for having the individual advice, or being involved in our groups, answering those questions. Remember that keto, specifically that, and this webinar and our CSIG that's coming up, and we're not going to be talking about a ketogenic diet, but you know that I'm totally in favor of that way of eating. Keto addresses so much more than size. It addresses pain, it addresses the tissue health, it reduces inflammation. So during the time of doing a ketogenic diet, however you implement it, you probably improved the health of your tissue, but unfortunately you didn't really notice the size difference. And Angela also says, do you think these findings will make it more difficult for insurance to approve for those wanting surgery? Actually, no. I do not think that it's really two different situations. I don't think that because there is other options besides surgery that it's going to keep you from getting surgery. There has been, however, a concerted effort, especially in Europe, to remove manual lymph drainage out of the equation because they believe that there is no edema in lipedema, and therefore why do we need a manual technique that's meant for reducing edema? And there is some fabulous research, which I'll report on next time, that just came out in 2022 that shows that there is edema in women with lipedema. And so there is a need for manual lymph drainage besides all the other things that manual lymph drainage does for lipedema besides reducing edema. So I think that this paper talking about these non-surgical options and showing it can work will help people that are trying to have those non-surgical options paid for, because it shows that these do work. Insurance really wants to pay for the things that work. And there are plenty of papers, unfortunately not controlled studies, but there are plenty of papers talking about the effectiveness of surgery. They're not super long-term. We don't know how you are 2, 3, 4, 5 years down the road after surgery, but they do show spectacular size reduction in pain in the short term. So, and for the insurance companies, they see that outcome, and that is helping. We're getting more insurance companies that are agreeing to cover this. But it is a continual battle. Anytime you're trying to get your insurance company to pay for something, they don't want to release those dollars. So they would prefer not to have to pay anything. And so if they feel like they have any justification in refusing, they're going to do it. And a lot of times it's just a matter of course that they refuse on the first ask, but then as you come back with more justification, then they approve it. It is not an easy road, trying to get insurance to pay for your non-surgical and surgical treatments. So any information we get out about lipedema is going to be helpful in the long run to women with lipedema. So I'm really in favor of getting that research done and learning at everything we can about this condition and what would be best to help manage it. Thank you so much for being here with me today, and I will see you again. Remember, I'm on the first and third Thursday of the month, so I will see you again in August. Bye-bye.